The third, I think, aspect of new diplomacy is that the struggle for power and influence in the world traditionally focused on what Sarah already described as hard power, the kind of military and economic might that went a long way to making sure that your country's national interests were met. But what we see today is a move away from that, or at least a rebalancing of hard and what's known as soft power, the power of ideas, the power of norms, the power of values. So we see a competition or a contestation of different normative frameworks, human rights, security, in public health it may be biomedicine, equity. All these are normative frameworks which are really battling for influence on the policy agenda. So what we see in the past is, well, we might see might equals right. Maybe in the future it'll be right equals might. And then finally, the last point about new diplomacy, there are new ways or different ways of conducting diplomacy, the kind of mechanics of it, and particularly around information technology. This is a picture of President Obama, of course, using his famous BlackBerry. If you go to any international negotiations now, you see people, emailing each other within the negotiating forum, so that positions can change as negotiations are going on. There's lobbying within the chamber, not just outside when you're having coffee and sort of networking. It's a much quicker process in some ways, but much more complicated. You can imagine people jockeying for position and so on. But information technology is not making it easier or harder, it's just making it very different from the way that diplomacy was conducted before. This has led to a great interest in what is global health diplomacy, and I'm just going to put these up rather than to read them to you. But what it really shows is that there are a lot of takes on this concept. There are a lot of ways that people have defined it. Perhaps I'll just pick out a couple. Fossey in 2007 talks about winning hearts and minds in poor countries, the kind of using health aid to gain influence in countries, perhaps in the war on terror, for example. Tom Novotny talks about a political change activity where you're using diplomacy to try and improve global health. I'm going to just skip to the next slides because it really want to draw two distinctions, I guess, two uses of the term in the existing literature. One is using the term in terms of global health as a way of furthering foreign policy goals. So Tommy Thompson, for example, talks about medical diplomacy and says that he describes it as a way to further America's causes around the world. So instead of worrying about any types of wars, if we could somehow substitute the integration of health policy with our state policy, I think we could accomplish a lot more. This hearts and minds idea, quite utilitarian in many ways. A similar view, I guess, is Harold Varmus, who talks about science, and he talks about how we can build alliances here. That's the essence of what he's trying to do. We'd be looked at as leaders who take a humanitarian interest. I believe doing good things in health and science is not only good for pragmatic interests, but investment in global health is in the national interest. He's very different from Tommy Thompson, but it's sort of the same kind of way of looking at global health diplomacy. And if you look at the contents of Hillary Clinton's recent speech on the Global Health Initiative, you'll see very similar language being used. What is global health diplomacy what has global health got to do with foreign policy? And she talks about national interests, about security, and so on. A slightly different way, or a very different way, I guess, of looking at health diplomacy is to see how foreign policy can be used to further global health goals, so flipping that around a bit. And the Oslo Ministerial Declaration of 2007 really captures that. And it was a declaration signed by, I think it was 7 ministers of foreign affairs, foreign policy, who tried to put health onto foreign policy agendas in order to further health, not to further necessarily foreign policy goals. So they say, writing in The Lancet, we believe that health as a foreign policy issue needs a stronger strategic focus on the international agenda. We've therefore agreed to make impact on health a point of departure and a defining lens that each of our countries will use to examine key elements. of foreign policy and development strategies, and to engage in a dialogue on how to deal with policy options from that perspective. So health is at the center, not foreign policy. With all of this sort of swirling around, what myself and colleagues in various institutions have tried to do is give some greater conceptual rigor to the concept of global health diplomacy. WHO has done that to some extent by defining it as a bringing together of different disciplines. So they talk about public health, international affairs, management, law, and economics, and it focuses on negotiations that shape and manage the global policy environment. There's a network that's been established which has put together quite a academic-y type definition, which I'll let you to read. But really, this is my final summary, really, is that we need to get past the hype, and we need to get past, using it as a kind of just a way of rationalizing what you've already tried to do. We need to refine the concept of global health diplomacy more, and I think the panelists may indeed contribute to that. And only then can we really start to build the capacity to try and engage in global health diplomacy so that the promise can be achieved. And what we want to do is move from that Tower of Babel really to a kind of choir effect where we can all be singing in the same note and achieving a lot more in the process. Thank you very much.